Hello everyone. There's a 35-year-old lady who come to you for follow-up on genetic testing for Lynch syndrome. The no symptom or medical problem and has never had surgery. PEP tests were done normal last month. Her mother, aged 54, is receiving chemotherapy for colon carcinoma. Her maternal uncle was diagnosed with colon cancer at the age of 49, but it is in remission. First cousin died of colon cancer at the age of 36 years only. In addition to colon cancer, the patient is at greater risk for which of the following conditions? Well, answer is endometrial carcinoma. But in the question only they talked about Lynch syndrome, which is hereditary non-polyposis colon cancer. So let's learn the basic concept about this condition before we really proceed for the discussion of the question. So this Lynch syndrome is autosomal dominant. 5 to 7% increased risk of colorectal carcinoma. Well, remember in the mother also, maternal uncle also and cousin also, they all have colon cancer. So this lady also have a risk of colon cancer. Proximal colon is usually involved. Now it is DNA mismatched repair gene mutation. Defective mismatched repair genes are located on chromosome 2, 3 and 7. Adenoma in patients with HNPCC have a higher incidence of high-grade dysplasia and villous architecture. Well, as far as colorectal carcinoma are concerned, they are poorly differentiated and mucinous and have signet ring histology, so-called Crohn's-like pattern of tumor infiltrating lymphocyte. Lynch syndrome, CRC only, one that is colorectal carcinoma only, but two have some associated malignancy also. That means not only it is a colorectal cancer that can happen in these patients, there can be other malignancy. Let's look into those malignancy which can happen in these patients. Now the gold standard to diagnose this is a detection of a germline mutation in MMR gene. Once diagnosis is made, then patient should go for colonic cancer with colonoscopy. It's a mandatory because it is a high-risk patient are these which can develop colon cancer. Now, not only there are colonic cancer, there can be extraintestinal cancer also like endometrial, gastric or ovarian. So as the question was, the option was endometrial cancer. So these patients are high risk for endometrial cancer, and endometrial cancer screening with annual endometrial biopsy should be begun at the age of as early as 30 to 35 years. Ovarian cancer risk also increase and may present in relatively younger age group. And so prophylactic hysterectomy and bilateral oophorectomy is recommended at the age of 40 or earlier if childbearing is completed. So now we are clear about why the answer is endometrial carcinoma. Let's look into other option. Breast carcinoma can be caused by BRCA1 or BRCA2 genes. It also impart increased risk of ovarian cancer, but they do not have increased colonic cancer with this mutation. So this option ruled out. Clerical renal cell carcinoma and pheochromocytoma can be due to von Hippel-Lindau syndrome. They are also dominant, but they are not associated with colonic cancer at all. Hepatocellular carcinoma, important risk factors are hepatitis B and C, and most secondary liver cancer originate from colon, and this patient should be risk for hepatic metastasis if she had sign of colon cancer. Okay, weight loss, bloody stool. So again, hepatic cancer is not a direct related to colon cancer. Colon cancer is in the colonic cancer, and then endometrial cancer, and secondaries in the liver can be there. Medullary thyroid carcinoma, MEN, okay, type 1 syndrome is characterized by parathyroid pituitary and pancreatic tumor. MEN2 is characterized by medullary thyroid carcinoma, pheo and parathyroid hyperplasia. Point to be noted that it is MEN2 which has the medullary carcinoma, not in MEN1. Both syndrome are autodominant, but colon cancer is not a feature of either of these. So a quick recap about heredity cancer, Lynch syndrome, colonic cancer, endometrial cancer, and ovarian cancer. Okay, the mnemonic is CEO. CEO of any company. Familial adenomatous polyposis, colorectal cancer, dermoid osteoma, and brain tumor. The mnemonic is B, C, and D. Easy to remember. Von Hippel-Lindau syndrome, hemangioblastoma, FIO, and clear cell renal carcinoma. But this is single most important. You cannot afford to forget. This is due to this hemangioblastoma. They have a polycythemia. This is due to increased erythropoietin. And of course, this can be done by the renal cell carcinoma also, but whenever we talk about von Hippel-Lindau syndrome, we talk about polycythemia due to hemangioblastoma. MEN1, type 1, parathyroid adenoma, pituitary adenoma, and pancreatic, 3 Ps. PPP. MEN2, medullary thyroid carcinoma, FIO, and parathyroid hyperplasia. And BRCA1, breast cancer is increased. Ovarian cancer, B and B, you remember, mnemonic, BB is breast cancer. Golden line to remember, Lynch syndrome is caused by colorectal cancer and is extremely high risk of endometrial carcinoma of the females. Annual endometrial biopsy as well as prophylactic hysterectomy is recommended to prevent endometrial cancer. Germline mutation in MEMR gene, that is hereditary non-polyposis colon cancer with so-called Lynch syndrome. This is a mnemonic to remember. Thank you very much.